your Filipino radio experience in Las Vegas. PHLV Radio. PHLV Radio.
The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Good evening. Magandang gabi po sa inyong lahat. Naimbaga Sardam, maayong gabi. Welcome to Healthy Mondays with AAPINA of Nevada. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. Well, here we are again on a Monday evening. Guess what? Over this weekend, wow, before we start our topic, over this weekend, I look at the sky and it's all white. I was waiting for the sunlight to go through my window and there's no sunlight. And I look out and there was this big orange sun. So praying for all of the people in California affected by the fire. I hope no fatalities, so please be safe. We are still in the COVID-19 pandemic, so please stay safe. Follow the protocols. We're about 2 steps back again because of the Delta variants. So tonight, we're going to tackle what is really Delta variants. And I have a colleague and friend who is not new to Healthy Mondays. Welcome to Healthy Mondays, Dr. Mandal.
Thank you. Thank you, Marife. It's always good to be with you and PHLV Radio and to the listener once again. Thank you.
Would you like to greet our listeners out there in Indian?
Yes, in Indian style, namaste. That's our traditional greeting, meaning welcome. I bow to you. Thank you for giving me the opportunity.
It's a pleasure always to have you in our show, Dr. Manas Mandal. We'll call each other Manas and
Manas,
yes,
name,
Manas.
first name, please.
Yeah, so if our listeners out there, this is your first time to hear about Manas, he is an expert in immunology
And vaccines.
maybe you can share with them your expertise.
All right.
Yes.
We'll talk about it, Marife. Yes. Grew up in India, then started working in US about 28 years back. And I work in the area of immunology and vaccines. So I was very closely watching how this pandemic is spreading all over the world, including US and my home country in India, and vaccine development and latest development, so-called variant, such as Delta variant, which ravaged India. Now it's all over in US, including our valley, Las Vegas Valley. This is the highest infection-causing strain right in the valley and in the country. And as you started talking about it, yes, we made progress. When vaccines were approved in mid-December through early January, many of us got our vaccines very early on and slowly, and things started improving. Infection was controlled, and we went back to slowly normalcy as much we could with some restrictions. But suddenly, in the last 1.5 weeks, about 2 weeks now, we are in a little bit dire situation. The total positivity rate, meaning if you test 100 people randomly, 15 of them are currently being infected with the Delta variant right in the valley. So everything is started on the restriction mode again, wearing masks, maintaining the distancing, and all the health safe practices that will keep us going through this new emergence of the Delta variant.
Maybe we can start, what is the new Delta variant of COVID?
Yeah, it's a very good question. So to begin that conversation, I should mention a little bit, what is a variant actually?
Yes.
A variant is a new strain of the same old COVID-19 virus that started infecting worldwide. What happens when virus infects, they change their genetic materials. So essentially, in simple words, they kind of become a new form of the old virus. Therefore, when they become a new form, then sometimes, and unfortunately with this virus all the time, they become more infective, more virulent. So this so-called Delta variant started in India about November last year. Even prior to that, we had Alpha variant, which came to all over the world, in India to US, that's called Alpha variant. These are some of the small genetic mutations, alterations of their gene sequences in the virus. When the virus infects someone, they go through these changes. Why they do so? Because they want to have that advantage over us, meaning the people they are infecting, so that they can keep on infecting new people over and over again, and to new individuals, maybe who are not vaccinated. So, taken all these things together, there are many variants of this virus spreading all over the world. Currently, Delta variant is the most widespread strain all over the world, including US. The recent data shows that over 90% of the new infections in US for last about 4 weeks now is caused through this Delta variant infection. Why it's notable? Because it's more infective compared to the original strains of COVID-19 that started last year.
So I did a little bit research, Manas.
Yes.
Delta, they said it's the B16172.
Yeah, B161, yeah, 617.2.
Yeah.
I did not go into the detail.
Yeah.
There is specific mutations in the spike protein. What that specific mutation did is it made the original virus little more so-called sticky, meaning binding better. And once they bind at a higher strength to our S2 receptor structures in the individual's body, that's how the COVID-19 infects us. And where those receptors are expressed? In our nose, in our throat.
The orifice.
Yes,
Yeah.
then they actually grow much faster. So previously, with the original infection, it was about 6 days before one can detect a virus infection in someone, if one gets exposed to the original SARS infection. But with the Delta variant, that 6 day become 4 days. Not only that, one is generating more copies of the virus, meaning viral load is even higher compared to the original strain. Taken all these things together, shorter incubation period, higher viral load, people are getting more sick. That's the real story for Delta and Delta 2 variant actually.
So for inquiring minds, the B16172 Delta variant of the severe acute respiratory syndrome
SARS.
coronavirus 2, which is the SARS-CoV-2,
yes.
The virus that causes coronavirus disease, the 2019, which we call COVID-19.
COVID-19, original strain.
Yeah, it has contributed, just like you said, to a surge in cases in India, and now has been detected across the globe, including a notable increase in cases in the United Kingdom.
Right.
So I wanted to give an update about the Philippines, and I know I asked you to give an update about India.
I will talk about the Indian situation after you talk about what's happening in Philippines.
In the Philippines,
Right.
yes. So this is from the news from the Philippines that the Philippine President Rodrigo Duterte approved the lockdown measures in the capital region last July 30th. This is an attempt to contain the spread of the Delta coronavirus variant and to shield the country's medical system. In Manila, the capital region consists of 16 cities, home to more than 13 million people, and will be under tightest quarantine from August 6th to August 20th, 2021. So for those who are planning to go to the Philippines, you can't go.
Can't
you
go
can
there
go,
anymore.
but you're going to be on a
Yes.
lockdown.
Right.
Lockdown means, for people who don't know, but I'm sure everybody knows what lockdown
By this
is.
time, everybody should know what is lockdown. You cannot
Yes.
go out of your house. You need to be
Yes.
quarantined if you travel into the city. And most likely, you cannot come back to US or to your home, other places, if you are required to be quarantined without showing the proof of immunization, vaccines,
Yes.
proof of SARS-CoV-2 negative test results, and etc.
Yes, and in the Philippines, it means people cannot leave their homes except for essential shopping,
Right.
While indoor and dining is banned. According to this chairperson of the Capital's Council of Mayors, Benjamin Albalos, he said, quote, Delta is all over Metro Manila already. The highly transmissible Delta variant was first detected in India and has rapidly spread across much of Southeast Asia, unquote.
Yeah.
So the Philippines also extended a ban on travelers coming from 10 countries, including India. Of course,
Yeah.
Indonesia, Thailand, and the United Arab Emirates to August 15.
Yeah.
And so the Philippines has recorded, we're going to go into statistics right now. The Philippines has recorded over 1.58 million COVID-19 cases and 27,722 deaths, with reported 216 cases of the Delta variant. And so the Philippines is now the second worst coronavirus outbreak in Asia. And then the second wave in the Philippines outbreak peaked in April, but infections have started to rise again in the recent weeks. And the hospital occupancy in the capital area is 49%, while the rate for intensive care beds is 58%. The mayors there plan to step up vaccinations to 250,000 doses a day, up to 150,000 currently. So
That's a staggering, dreadful data.
That's the data from the Philippines. Would you like to share
Yeah,
with us?
I'll share
about
without
India?
going to the details of the numbers, but what I want to tell the listeners at this point, yes, since this Delta variant originated in India after several additional mutants on the Alpha variant that originated in United Kingdom, it really caused really havoc in the Indian population. It started around the same time as of Philippines. It started around early March. Slowly infection picked up. There are many events that led to the serious surge of the infection in India, such as various religious festivals and nationwide elections in many states of the country. And all those gatherings, processions, and all those things led to the very rapid fire, widespread infection with Delta variant in India. So what was the outcome? So from mid-March up to mid-May, it was simply massacre. Massacre means there were acute shortages of hospital beds, ICU type of facilities, lack of oxygen. People literally waited to get a cylinder of oxygen on the street in front of the hospitals, and many died due to simple lack of oxygen. I can share some personal stories. In my family, I got my mom vaccinated early on when the vaccines were available. My mom is 86-year-old, my elder brother who takes care of herself. But many other people who were hesitant early on to take the new vaccines, they got the infections. And I have death in my extended family members, and I have deaths within my friends' family circles, and etc.
I'm sorry to hear that.
Yes, thank you. But what I'm trying to say that this Delta variant really caused serious infection, lots of loss of lives. The country completely shut down. The healthcare system got overwhelmed. No beds were available, and literally people were so miserable to get any minimum health care and treatment. Eventually, through more vaccination and emergency relief supplies from all over the world reached India. So from mid-May onwards, through June and July, situation got under control. Now we have flattened the so-called curve, and taken together, it took a huge death toll in India. India currently ranks second after US death toll. US is over 6 million. India, I believe, somewhat about close to 5 million death. So, yes, about 4 point something. Close to 5 million death in India due to the this Delta variant infection, which is second to total number of dead people all over the world, second to US. So currently in India, infection is under control after various emergency measures such as lockdown, once again improving the vaccination rate, and putting those emergency medical treatment facilities such as intensive care ICU type of facilities, oxygenation, and various use of various types of breathing capacity, such as ECMO machine, extracorporeal machine related breathing to the seriously infected individuals. So right now, India is in better shape. Infection is down below about 2% all over the country. That's the infectivity rate, varying between 1.19 to below 2, varies between state to state. But there are still hotspots, particularly in one of the southern states of India, which is Kerala. From that state, a lot of people travels to Far East countries such as Philippines and Bangkok and everywhere for their job and etc. That is currently a hotspot because a lot of people travels into that state and a lot of people from that state travels all over the world for their jobs. So that is still a hotspot in the country, but it is slightly better, and I would say not slightly, reasonably better, arguably better. People from outside, from US, can travel to India and can come back following the regular guidelines such as vaccination, proof of vaccination is required, wearing mask and quarantining after reaching the country for 2 weeks, home quarantining, and to come back to US from after travel from India, they need to follow the same protocol, show the proof of non-infected state such as RT-PCR negative test results. Then you can board a international flight to come back to US, and of course after coming back one required to self-quarantining for 7 days because we are all vaccinated. Actually, I was planning to travel to India to spend a couple of weeks with my mom. I'm still watching out very carefully because infections slowly started increasing in different parts of the country. But overall, infection is down and vaccination rates are picking up slow, but that still needed to go far, far more. It's below 10% overall immunization rate, below 10%.
Yeah, thank you for sharing about information about India update. I can't help but I picked up some of your story before it came about, the cultural values, the cultural traditions,
Right.
and it's so similar to the Philippines tradition. You know, when they have fiesta,
Right.
they have, gatherings, because human beings are created to be social. And
Yes,
we have
we are
talked
meant to
about
be
this
meant to
before. Yes.
stay together, do something together, interact with another human being, and by nature, Far East, we are pretty much from the similar region. Asian people are more, I would say, we are more embracing people. We embrace each other with much more closeness compared to the Western society, Western civilization, because that's our tradition. We will invite a guest, even that individual is not very well known. We will invite them in our house. We will share a meal with them. We will talk to them in close contact, and we'll touch them, touch their feet, or greet to them as they come to our home.
That's the hospitality of
That's
the
the
Asian
hospitality.
culture, right?
Yes.
The
We
Asian
share the
community.
similar culture in all over the Southeast Asian region, and that's also makes us vulnerable because people likes to congregate together, chat with each other in the neighborhood tea shops, neighborhood coffee shops, noodle places. They will sit down and talk to each other, share a bowl of noodles and have a cup of tea and talk about each other's how they are doing, their wellness and etc. That's our culture. But at the same time, that makes them very vulnerable and prone to catch infections also.
And that's a struggle in itself, you know,
Yes.
to stop people from doing what they have been
Doing
you
all
know,
throughout their
brought-
life. Yes.
They grew up as mingling and
Yeah.
socializing,
Right.
and so that's another episode about the mental health here.
Yeah.
But going into continue about the Delta variant, I know that in Uganda also, because as you know, I teach
Yes.
in the Uganda
Right.
Christian University there.
Right.
And we're doing a virtual classes right now, and
Okay.
I have 12 students, and some of them were actually infected with
Sorry
COVID.
to hear that.
So we're trying to monitor them, and we're trying
Okay.
to be more lenient about the projects and the
Right.
assignments. But the next time I will share with our listeners out there update in Uganda. We had given update about the Philippines. We have given update about India. And I also I wanted to share update for Nevada.
Yes.
Not everybody is listening to our to the news, so hopefully you are listening to our show here.
Right.
And I wanted to give an update about the COVID Delta variant in Nevada, and then we'll go back to you with more information about the Delta variant. So as of August 4th of this year, Nevada has 24 coronavirus deaths reported as the 2-week moving average of daily deaths increased to 8 per day. And I wanted to also share that when I was taking my students in the clinical setting, as I am a clinical instructor for a nursing program, and the last 2 weeks of our clinical rotation, there was one in the facility that I was training my students. There was one positive COVID patient on our unit. And immediately the following week we came back, there were 5. So you see how it increased rapidly. Yes. So the state also reported 993 new cases, raising the total of to 361,140 cases and 5,953 deaths, according to the Department of Health and Human Services website.
Yes.
So the 2-week positivity rate jumped from 0.4% to 15.5%.
That's what I mentioned. Current rate of infection, moving 2-week target is average, not target. Moving 2-week average of infectivity is about 15%, and within that 15% infectivity, over 90% of those infection is due to Delta 2 variant, and which is dangerous. And there is another aspect I like to mention in this context is that even who have been immunized with Moderna, Pfizer, or Johnson & Johnson vaccines, they are protected. They are protected pretty reasonably, but still there is a little down regulation or inhibition or lowering of the immune protection against these Delta 2 variants. Following that information, CDC and FDA will most likely, in next 2 weeks, will announce a booster dose by Pfizer and Moderna. They were working on those booster doses, and it will be considered by FDA within next 2 weeks, and most likely beginning of September, when fall season comes in and flu season begins, another infection, kids are going back to the school, perhaps there will be a recommendation of a booster dose with either Pfizer or Moderna, because our immune memory through those vaccines that we took about 6 months back, little bit dwindling down, and we want to keep it at a high level, giving ourselves one more booster dose so that we are capable of fighting not only Delta variant, and there is already a talk about a very new variant, which Lambda variant, which is already in the discussion. We scientists and clinicians do not know much about that Lambda variant, but it could be more effective. So to protect us in future, there will be a requirement of booster doses. First, it will be recommended to elderly populations, patients at the nursing home, health, long-term care facilities, and the healthcare professionals like you, Marife, frontline care, because they are constantly getting exposed to the variant. They are vaccinated, but their vaccine-induced immunity may not be protective enough. And there is some data that shows that after 6 months, the immune protection goes down slightly. But if one is vaccinated, even they catch this Delta variant, data suggests that they would not be required hospitalization and they would not die. Those vaccines are still over 90% protective. And people who are being hospitalized, over 99% of them did not take their vaccines, and who are dying, almost 100% are not vaccinated.
They're not vaccinated. Actually, the report that I was going to share now, that I was talking about the 2-week positivity rate jump from 0.0% to 15.5%. That's more than 3 times the
Higher.
5% threshold recommended by the World Health Organization.
and
That's to
CDC.
curb the spread of the virus.
Right.
So the rate of positivity was at the lowest last June 9th at 3.3%.
Right.
And hospitalization also have been climbing from 209 last June. And the state reported 1,206 hospitalization of confirmed or suspected cases of COVID-19, which surpassed the high water mark of the second wave last summer.
Yes, actually, currently, I was going to mention
Yes.
that that's a very good data point. What
Yes.
its simple words, it says that we have currently, right now, in the valley, in the Clark County, more infection, more hospitalization compared to this time last year. And compared to the last year's strain, virus, current virus, Delta 2 variant is way, way more infective, more dangerous. Therefore, we are in more serious situation, critical situation
Than we were
compared to the
before.
last year,
Yes.
this time.
So as of last week, there has been only 235 reported hospitalizations involving breakthrough cases in fully vaccinated people in the state. But on the positive note,
Right.
what they're saying is that hospitalization in the ICU and patients requiring mechanical ventilation remain below the previous levels compared to summer 2020. And that's
Yeah.
when you're talking about those who were fully vaccinated.
Fully vaccinated.
Yes.
What
And-
what it say, sorry, 1 minute.
ahead.
What it says really is that vaccines still work.
Yes.
Although there are so-called breakthrough cases, what does it mean? It means people who got vaccinated, unfortunately, they have contacted the infection once again, and very few, totally throughout the country, over 168 million Americans so far immunized,
Which is good news.
which is very good news. We
Keep
reached
at it, Americans.
slightly above 50%
Yes.
right now overall. And one shot immunization, partially immunized individuals number percentage is about 70%. But if you consider that information to the breakthrough infection, it is 0.04% of the totally immunized individuals. That means people are still largely protected even against this variant. But there will be some breakthrough infections, meaning vaccinated individuals might as well get infection, but those are not the individuals who are usually being hospitalized and dying. The most seriously infected individuals with Delta 2 variant are the people who never got the vaccines, even when it is available nationwide very freely, very easily. So it is time to get vaccinated, folks.
And I think kudos to our Clark County public officials because they promoted an incentive-based
Right.
programs such as $5 million state
Yes.
raffle and numerous pop-up vaccine events to encourage the community to get vaccinated. And so far, the vaccination numbers have been started to increase. As you
That's
have
the
mentioned.
good news.
Yeah. So the 2-week moving average of doses administered to Nevada residents per day was 6,210 and well above average of just under 5,000 few weeks ago. And so
yes.
Nevada is still below the national average
average.
in vaccine numbers with 48.02% of the population of 12 and older fully vaccinated. And so the Clark County has accounted 88% of the samples collected in July with Delta variant, a significant increase from 59% reported last June. And then for the Southern Nevada Health District, they reported 725 new COVID-19 cases in Clark County last August 4th, with the local total cases of 284,046 included in the statewide totals. So unfortunately, there are 23 new states deaths with current total of 4,744 deaths in the Clark County alone. So we still are not
Out of the woods
out
yet.
of the woods. So
Yes.
you still need, for those who are not vaccinated yet, please don't wait to find out how it is for other people because it might be too late.
Yes,
Right?
Absolutely, you are right, Marife, and we cannot emphasize more. This is the time. If you are waiting, not very sure whether you should get the vaccine, there is nothing to wait any longer, because those individuals who died, there's the statistics that you mentioned, majority of them, over 90% of them never got vaccinated. That's the data. Vaccines still protect everyone, would protect everyone largely. Even there is a breakthrough infection, most of the time one would not need any treatment. Little home quarantining, little rests, and little maybe Brufen and drink enough water, take some rest. That
Just
will
like the flu.
flu-like,
Yeah.
like flu-like symptoms.
Except it has a
Yes.
lot of
Respiratory,
respiratory it's
distress,
more-
distress, and sometimes pneumonia. So vaccination still protective, and it did protect a large number of individuals. I might want to mention one very interesting research they did. Without the vaccines that we have right now, there will be 1.2 million more infection
Yes.
nationwide, and over 325,000 dead Americans right now.
It's a domino
Without-
effect too.
Yes.
If they don't die, then they have to be hospitalized,
Right.
and we don't have enough.
We do not have
resources.
Yes, and
right.
even someone survives the infection, don't forget about the long-term effect of the COVID. I was talking to one of my longtime friend back home. Unfortunately, he got COVID. Both his parents died, and he is still recovering from the fatigue, from the little bit of sort of memory loss after he recovered about a month back. So even someone gets infected and recovers, it's not fun.
Yes.
It may as well take very long time to recover, to gain back the full normal functioning and doing your daily chores as before. So taken everything together that we discussed this morning, this afternoon, it's time to get the vaccines. Cannot emphasize anymore. If you are hesitant, if you are waiting for more information, these are very safe vaccines. Over 170 million Americans got the vaccines. They are safe. They are protected. Get your vaccines. Protect yourself, protect your family, and protect your community. Because children below 12 years of age cannot get the vaccines.
Yes.
We need to protect our children.
Your loved
certain
ones.
loved ones,
Yes.
certain individuals
Yes.
who cannot get the vaccines. We have our responsibility as a citizen, as a community member, to protect them, not to get infected. Thus, we do not spread the infection to those vulnerable people around us.
Yes, and there you have it, our listeners out there. I wanted to give you the statistics, but at the same time, personal story like Manaz sharing with his personal story about families who were infected and people who are, who actually die from
Right.
coronavirus. I also have people from my hometown that I know that also passed away from
Yes.
the COVID.
It's real.
It's real. So that the numbers may be numbers, but the story.
There is a
the
human being
personal-
behind those numbers.
Correct. The human beings behind those numbers. So thank you, Manaz, for coming back again to Healthy Mondays and once again giving us very important information about wellness,
Yes.
about this COVID-19 that's not going away yet.
It
I
will
mean,
stay with us, unfortunately, for maybe for a few months, hopefully, but I can foresee that might linger into 2022. But
Yeah.
there is a weapon. We have a shield, which is vaccines. If vaccination rate increases significantly, up to 70% minimally of US citizens gets their vaccines, and together we can overcome, we can defeat this infection.
Thank you, Manaz. Thank you for being our guest tonight and PHLV Radio. Johan, thank you so much for your partnership. My big question is, are you vaccinated? If not, get vaccinated. So, remember, every Monday is a Healthy Monday. Aloha.
Namaste.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.